introduce yourself?
So, hello, my name is Grace Marie Alunan Maclan. I'm a BS Pharmacy graduate from the University of Santo Tomas, batch 2005, an MS Pharmacy graduate, UST Graduate School, batch 2012, and currently I'm taking up my PhD in pharmacy. Hopefully, I'll finish before 2020.
What inspired you to take up pharmacy?
My inspiration for taking up pharmacy was my grandmother, who was actually also a graduate of UST BS Pharmacy program way back 1954, I think, or 52. During when I was growing up, they had their own pharmacy in the province, but I really didn't have any idea with regards to the pharmacy practice until I reached siguro third year or fourth year high school, when I was already looking up to my options for college. So I wanted to take up microbiology, and parang sabi sa akin before, wag ka nang mag-micro kasi pag di ka naman mag-med, parang there is no career that you can go into. So, ang sabi sa akin, kung gusto mo ng ganong linya, micro, mag-medtech ka na lang, tapos i-second choice mo ang pharmacy. So, unfortunately, I did not make the cut for the medtech program. So, I was on waiting list for pharmacy. So, I entered the UST pharmacy program, and then later on I enjoyed the the course. So hindi na ako nagdalawang isip, dinire-diretso na. So hindi na ako nag-shift.
What are the academic and other requirements for the profession?
Academic, so you need to pass the 4-year pharmacy program. 5 years if you want, or if you're planning to take up the clinical pharmacy, and then you also need to take your internship, okay, which is also one of the requirements before taking the board exams. So after that, so internship, you have your internship, you already graduated the BS Pharmacy program, then you need to take the board exam. So after the board exam, pag nakapasa na, then you can start to practice the profession. Pero yung license nyo, kailangan 21 before you can get the license. Ako, naghintay pa ako ng siguro mga 5 months bago ako nakapag, kasi I took the board exam 20. So, November yung birthday ko. So, I had to wait until I was 21 to get my license.
Miss, so, follow-up question po. If wala pa kayong license, di ba? Hindi talaga kayo makapag-practice?
During that time, parang hinire na ako as a pharmacist, pero kumbaga hindi pa pwedeng walang certificates na i-display doon sa pharmacy na. Kumbaga kailangan pa rin nila ng isang license. Parang that time board passer pa lang ako. So wala pa akong lisensya.
Can you describe what the nature of your work in terms of responsibilities and advantages and disadvantages?
So as a pharmacist, nature of work, kasi the first thing that comes to people's mind when we talk about the pharmacy profession is just being in a drugstore. Minsan nga, di ba yung tawag sa pharmacist is the glorified sales lady, because yun lang yung perception ng tao when it comes to the pharmacy profession. They are in the drugstore, sila yung nag-aabot ng medications to the clients or to the customers. But it's more than just giving the medication when we talk about the pharmacy profession, it is first, you are responsible for the medication, okay, and also the information that you need to give to the patients. So kapag nag-dispense tayo, kasi yun yung nakikita ng tao, pag nag-dispense tayo, hindi lang dapat na binibigay natin yung medications to the patient. We also need to give information to the patient on how to properly take their medications. Okay? Now, aside from dispensing medication, pharmacists can also work in the industrial or the manufacturing field. So, they are the ones who do drug formulation, manufacture of medication, research and development, and then they can also work as clinical pharmacists. They They monitor the patient's condition after taking the medications. So those are just some of the other job classification, or what do you call this? Other work that a pharmacist can do. It's not just giving the medications to the patients. So, disadvantage yun nga, pag pharmacist ka, yun yung unang perception ng tao. Nandun ka sa butika. Okay? So, yun. Yun yung sa akin. Pero advantages marami kasi if you work in the hospital, you get to communicate with other medical professions, you get to have a patient interaction talaga. Pag nasa manufacturing ka naman, you get to develop new preparations for different conditions. Yan. So, yun.
What are the qualities of a pharmacist in order to practice his or her profession? And what are specific requirements and qualities for this field of practice?
Okay. So, qualities, unahin muna natin yung sa pharmacist as a whole. Qualities of a pharmacist, kailangan matyaga. Okay? They should have a lot of patience. Kasi, for example, sa amin sa Academe, you need to be patient with regards to how you handle your students. You need to be patient on iba kasi yung ibang klase, iba yung lecture mo. So, kailangan medyo mahaba yung pasensya mo. Tapos, aside from that, kung nando ka din naman sa ibang field, yun pa din yung kailangan bit-bit mo eh. Let's say, for example, you are working in a community setting. So, you need to be patient with your patients. Meron dyan, especially if you have geriatric patients, marami ang tanong, marami silang medications na tinitake. So, you need to explain all their medications to them. Kaya minsan makakalimutan, so you need to repeat it again. Okay? Sa research and development din, ganun. Hindi naman, once that you test, automatic it's positive now. Everything would be trial and error. So, ayun, patience. And then, you also need to be knowledgeable with regards to the different drugs. Okay? Kasi, yan yung forte natin eh. As being a pharmacist, we are the drug expert. So, not necessarily you know all the drugs, but you need to have an idea na pag sinabing gantong gamot, this one is for this type of disease. So, as you go along the BS Pharmacy program, nade-develop nyo yan. And as you go on with the profession, you start to develop those types of knowledge.
What advice can you give to aspiring pharmacists?
Okay, so aspiring pharmacists, so number one is you need to balance everything. Okay? You have your social life, you have your student life, okay? You have your family life, you have your love life. Okay, so balance lang dapat lahat. Okay? Kasi hindi naman pwedeng puro aral. Meron part ng pagkatao ninyo na hindi nyo na-develop. Diba? So, as much as possible, we want to develop you holistically. So, ayun. So, number one is you balance everything. Okay? And then, you seek help. Okay? From your friends, from your classmates, from your parents, from your professors, if in case there are problems with regards to your studies, may mga hindi kayo naiintindihan, lagi naman nandyan yung mga professors nyo na pwede nyo tanungin, ganyan, yung mga classmates nyo, if you know that, ito magaling siya sa gantong subject, so baka pwede niya akong tulungan. Ayun, so you communicate with each other, you talk with your classmates. Kasi in the end, kayo-kayo lang din yung magkakasama, lalo na you are only one batch, one section, so kayo-kayo yung magkakasama. So, walang ibang magtutulungan kundi kayo-kayo lang din. Ayun.